Chronic and debilitating joint and muscle pain is commonly associated with Hashimoto's and other autoimmune conditions. But even if you don't experience the symptoms all the time, you're probably familiar with waking up in the morning and feeling several decades older than you actually are, or having difficulty engaging in the activities that you enjoy. So in today's video, we are going to talk about pain and why we experience it, how autoimmunity can contribute to increased pain levels, and also why we have to be extra vigilant about the development of additional autoimmune conditions when we're experiencing these kinds of issues. And if you enjoy this information and you find it useful, don't forget to subscribe to the channel and also ring the bell. I post videos every single Thursday, and that'll let you know whenever I post new content. My name is Dr. Brad Bodel, and I specialize in helping women with Hashimoto's and low thyroid to lose weight and improve their energy naturally. And I've helped thousands of patients to improve these symptoms through natural means like dietary and lifestyle changes. But one of the big things that we commonly deal with is pain. And for most people, when they go and see their doctor, they're either sort of written off and brushed to the side, or they're given a chronic pain diagnosis, which still doesn't really tell us where this is coming from. So let's start off today by discussing pain and what its actual origins are. Our body has a number of different sensory neurons, which essentially transmits information from the environment and from our body to our brain. Once that information gets to our brain, then we can make a decision about how we want to react to it. One of the subtypes of these neurons is called nociceptive neurons. Now, nociceptive neurons is the start of our pain pathway, and they respond to things like mechanical deformations, so that means compression to different joints or muscles, cuts to the skin, or even tearing of joint capsules. They will also respond to changes in temperature and chemical stressors, things like toxins from the environment, which could be anything from a toxic chemical to a spider bite, or inflammation within the body. Now, to stay healthy, to some degree, neurons have to be active all the time, and it's kind of like that idea of use it or lose it that we think about when we're exercising different muscle groups. If we're not actively working on those muscles, we're not going to be able to maintain the muscle mass that we desire. So when it comes to nociceptive fibers and nociceptive pathways, those fibers are always active. They're always firing off to some degree to maintain the health of those neurons. That way, when we actually need them, they're ready to engage appropriately. However, even though these nociceptive neurons are active all the time, it doesn't mean that we're always in pain. And the difference is the frequency and intensity of activation. So sure, on an average day, if I'm just sitting here, those nociceptive fibers are clicking off at an average rate. But my brain doesn't perceive that as a problem until there's some sort of external or internal stimulus that increases the frequency of firing from those neurons to the point where now it's engaging my brain in a much different way. But instead of just sitting here, let's say I started to push down on one of my muscles really hard. Well, the nociceptive neurons that are in that area are specially designed to be receptive to changes in compression and deformation of those muscle tissues. And so when that happens, they start to sound all these alarm bells and increase their message to the brain. That then not only lets the brain know that there's a problem, but it allows the brain to then activate our emotional and autonomic centers to respond to that potential threat. So pain is not necessarily the increased activity of nociception, although that is a part of it. Pain is the increased signaling from our nociceptive neurons in combination with the brain's emotional and autonomic response to that stimulus. So in a normal scenario, we have healthy nociceptive neurons, which are continually sending out a low-grade message to the brain, allowing them to stay active and functional. However, when the environment around those nociceptive neurons changes, they're going to increase the intensity of the message that they're sending to the brain. This is going to cause the brain to take notice of that part of the body, and it will then activate other parts of our physiology to allow us to perceive that area as being painful. But what if we don't have a normal environment around those neurons and they're not being activated by changes in our environment? Instead, they're continually being sensitized by inflammation in the body. Well, that's what happens with Hashimoto's and autoimmunity. Now, for us to actually activate these nociceptive neurons to the point where they are now more aggressively stimulating the brain in a way that allows us to perceive pain in a particular area of our body, we have to meet a certain threshold. Essentially, these nociceptive neurons can't be responding to every little thing in our environment, otherwise we'd be experiencing pain all the time. So think of it this way. Let's say the threshold for activating those nociceptive pathways is right here. But normally, the neuron is resting down at this level. So for us to activate those pain pathways, we have to overcome this distance. We have to have the activation of that neuron exceed that particular threshold. So if I just lightly press on my skin, that's not going to be enough of a stimulus for us to bridge this particular gap. But if I press down really hard like I was doing before, that'll be enough of tissue deformation and tissue irritation for us to get over that threshold and then cause those spikes in activity. So it's the difference between where that neuron is resting at and the threshold it has to reach to activate those pain pathways that protects us from experiencing pain all the time. So if we were to give someone a hug or brush up against something in our home, we wouldn't want that to cause us pain. And it's this difference or this separation that prevents that from occurring. But this is the point where Hashimoto's and autoimmunity comes back into the picture. What is one of the hallmarks of autoimmunity? Chronic, widespread inflammation. And because these nociceptive neurons are also sensitive to chemical changes, if we have a generalized increase in inflammatory chemicals in the body, that is going to change where our neurons' resting potential is at. So instead of having this big gap that we really have to overcome for us to experience pain, when we are inflamed, that gap shrinks. So instead of the neuron resting down here, it now starts to move closer to that threshold point, and that means less stimulus is required to push us over the edge. That means that simple and sometimes trivial things like walking, hugging, and even sitting can be enough to cause us to experience pain. And this can even get to the point where some of these conditions are so chronic and so progressed that just the natural weight and gravitational forces on our body can be enough to cause us to experience pain all the time. But because this pain is tied to inflammation and autoimmunity, the way that you can identify it is it will increase or decrease in relationship to the amount of stress that you're putting on your immune system. So if you're not eating the foods that you should be eating, not getting the amount of sleep that you should, or you're noticing more stress at work or with your family, then there's a likelihood that there is going to be an increase in your pain levels. Additionally, the pain that you're experiencing doesn't necessarily have to be tied to any previous musculoskeletal injury, meaning that it can occur in any joint in the body. Sure, if you were to have a previous, let's say, ankle injury, that ankle can become more flared up when inflammation levels increase, but it doesn't necessarily have to be reflected only in that one part of the body. Now, this is a pretty complex topic, so hopefully you guys are hanging with me. But if you have any questions, you can always leave them in the comments below. And also, let me know if pain is something that you experience when you've been dealing with increased symptoms associated with your autoimmunity. Now, even though I used the first few sections of this video to discuss how pain is a neurological function that can be exacerbated by changes in the chemical and inflammatory environment around those neurons, this last section is just as important, but it's a little bit of a deviation from what we've been talking about. So even though most people with autoimmunity will experience an increase in pain associated with inflammation, we also have to be aware that many people, when they have one autoimmune condition, can develop others. There are genetic factors that predispose us to the development of autoimmunity. And if we've set the environmental stage in a way that allowed us to be diagnosed with one, then the diagnosis of others becomes more likely. This is why you see such a strong correlation between people having Hashimoto's and also developing things like celiac disease or autoimmune gastritis. But just because those autoimmune conditions are gut-related doesn't mean we're limited to developing issues in only those areas. Things like rheumatoid arthritis and psoriatic arthritis are autoimmune conditions which directly affect our joints. Typically, people are taught to look for joint deformation, either enlargement or changes in the way those joints move in their hands and their feet as the first signs for some of these conditions. But that is typically not the case. Those things usually show up late stage, and it occurs many years after we are experiencing pain in those particular joints. So if you've been previously diagnosed with Hashimoto's and your symptoms, specifically your joint pain, continues to get worse, you're going to want to talk to your doctor and have them screen you for antibodies for those joints to see if you are in the early stages of developing autoimmunity for those particular proteins. So to quickly recap, pain is a normal part of our body and our physiology, and it all starts with the activation of nociceptive neurons. However, the threshold that we have to overcome to activate these neurons becomes diminished when we have widespread inflammation due to things like autoimmune conditions such as Hashimoto's. In addition, people with previous autoimmune diagnoses need to be aware that even though the most common cause of pain is due to the increased levels of inflammation, they can also develop other autoimmune conditions like rheumatoid arthritis, like psoriatic arthritis, because we can develop antibodies for the tissues in these particular joints. If you're looking to get a hold of your autoimmunity and start improving your symptoms and haven't done so already, don't forget to download my free guide, which is 109 foods to boost your thyroid and improve your energy. It includes a list of foods that I recommend for people starting out on their autoimmune health journey. Otherwise, if you like this video, don't forget to hit the thumbs up, subscribe to the channel, and check out some of my other content. But I hope you guys are doing really well. I hope you're having a fantastic week. My name is Dr. Brad Bodel, and I will see you next Thursday.